This is Neural Newscast for Monday, May 4th, 2026.
Here is what matters this morning.
From Neural Newscast, I'm Noah Feldman.
And I'm Evelyn Hartwell.
We begin with a growing diplomatic divide between the United States and Germany. President Trump has publicly criticized Chancellor Friedrich Merz following sharp comments regarding the administration's strategy toward Iran.
The tension erupted after Chancellor Merz suggested that the United States is being humiliated by the Iranian leadership. Merz questioned the effectiveness of recent diplomatic efforts in Islamabad, where negotiations have reportedly stalled.
Writing on Truth Social, the president responded by stating that Merz does not understand the nuclear threat. Trump argued that a nuclear-armed Iran would hold the world hostage, defending his current strategy as historically necessary.
The chancellor made his remarks while speaking to students in Marsburg, comparing the current situation to previous conflicts in Afghanistan and Iraq. He emphasized that the United States lacks a clear strategic exit and is being outplayed by the Revolutionary Guard.
Turning to domestic policy, Nebraska has become the first state to enforce Medicaid work requirements under the 2025 federal mandate. The program launched this morning, 8 months ahead of the official January 2027 deadline.
This early start is expected to impact over 25,000 residents who could face a loss of health coverage. Governor Jim Pillen defended the timeline, stating that work provides purpose and helps residents become productive community members.
The requirements apply to most able-bodied adults, with limited exemptions for caretakers and the medically frail. However, analysts at the Center on Budget and Policy Priorities say the state is rushing into a rollout it is not ready to manage.
Senior policy analyst Allie Gardner noted that Nebraska has not completed the necessary hiring to handle the transition. She expects call centers to be overwhelmed as residents navigate new verification standards and reporting workflows.
These Medicaid changes are part of a broader national shift. Republican lawmakers have touted work requirements as a vital tool to control the rapid growth of government spending.
Medicaid costs reached $971 billion last year, a nearly 7% increase. The Congressional Budget Office estimates the federal government could save $911 billion over the next decade through these reforms.
Michael Cannon from the Cato Institute argues that while the requirements impose obligations on recipients, the current system imposes an unfair burden on taxpayers. He believes the shift is a necessary correction for a program that serves 75 million members.
Still, many experts worry about the human cost of these savings. Joan Alker of Georgetown Center for Children and Families says many states are at a breaking point due to staffing shortages and existing funding cuts.
While Nebraska is the first to go live, other states are moving quickly. Montana is currently scheduled to implement its own work requirements this July.
Iowa is also moving toward early implementation, while Arkansas plans a soft launch later this year. Arkansas officials say they will not begin disenrolling residents until the official federal deadline in January of next year.
The state of Arkansas previously attempted a similar program that lasted only 9 months. During that period, more than 18,000 people lost coverage, primarily due to confusing reporting requirements rather than changes in employment status.
Amaya Diana, a policy analyst with KFF, found that those previous efforts led to significant increases in the uninsured population without a corresponding boost in employment. This data is fueling concerns about the national rollout.
Meanwhile, administrative costs are another major concern. Anthony Wright of Families USA described the implementation hurdles in Georgia and Arkansas as disastrous for state budgets and administrative efficiency.
The administration has also increased the burden on states by requiring them to recertify all Medicaid providers. This adds complex paperwork to a system that must now track work hours for millions of enrollees.
Nebraska officials maintain they are ready, citing targeted training for staff and coordination with federal reviews. State spokesperson Jeff Powell says the phased approach is specifically designed to protect those who remain eligible.
However, the true impact of Nebraska's move may not be visible for several months. Analysts expect the first major coverage losses to occur in August, as the initial cycle of eligibility renewals is processed under the new rules.
Next, we look at the federal regulatory timeline. The Department of Health and Human Services is expected to release final implementation guidance for the national mandate by June 1st.
That guidance will be critical for the 29 states that recently told KFF they did not have enough time to meet the January deadline. Without clear rules, many states fear their systems will fail to track compliance accurately.
Here is what else we are watching. King Charles and Queen Camilla continue their state visit to the White House today. The visit is intended to reinforce the relationship between the United States and the United Kingdom amid current diplomatic friction in Europe.
We are also monitoring the upcoming July deadline in Montana. As the second state slated for early work requirements, their rollout will provide evidence of whether state systems can handle the new reporting burdens.
Finally, the Congressional Budget Office is expected to release updated figures on national uninsured rates later this week. These numbers will reflect the early impact of the 2025 tax and spending law on healthcare enrollment.
The data will be a key indicator, Noah, for how the labor market is absorbing these new requirements. We will be tracking whether those disenrolled from Medicaid are successfully transitioning to employer-sponsored insurance.
This has been Neural Newscast. Thanks for listening.
Neural Newscast is AI-assisted, human-reviewed. View our AI transparency policy at neuralnewscast.com.